Hello viewers, welcome to Healthcare Hub. Today this is Reshma Tirupati and today I have started my psychiatric nursing top 80 bullet points and today we are going to start the session. So those who are come live, please confirm whether the audio and video is everything okay, whether everything is alright, everything is clear, whether you are able to listen to what I am telling. Those who are online, those who are online, please comment in the comment section. Is audio and video everything clear? Are you able to comment? Okay, Aruna, thanks. Jamala Sirisha, good afternoon. Actually, thought of coming at 11 o'clock itself, almost 1 hour I got delayed today. Yes, ma'am, it's clear. Okay, so today's session. So, how your preparations are going on, all of you? For ESA preparation is everything all right? So today's slides will be on. Whether I am visible on the screen? Okay. So today's slides are this. So today almost have thought of preparing 80 bullets, but later it has become total 100 bullet points, a total 100 slides I have come up with. So all these are the questions today I will be presenting. So totally around 100 bullet points we will be presenting. Okay. And those who are new to channel, please like our channel and share your nursing group so that it reaches all the nursing fraternity, and those who are preparing for exams, it will be useful for them also. Inka na telegram channel ఎవరెవరైతే జాయిన్ అవ్వలేదు, దిస్ ఈస్ ద పబ్లిక్ లింక్ healthcare_hub అని కొట్టండి, మీకు టెలిగ్రామ్లో ఇది పబ్లిక్ గ్రూప్, ఇది పబ్లిక్గా విజిబుల్ ఉంటుంది, సరేనా? So today's first point is, okay, so according to the Kubler-Ross, the 5 stages of death and dying are, so the first point here is, so according to Kubler and Ross, the 5 stages of the death and dying are DABDA, denial, anger, bargaining, depression and acceptance. So in exam they may ask what is the third stage of death and dying, like that they may ask, or they may ask a fourth stage. So you can say first one is denial, second one is anger, third one is bargaining, fourth one is depression and fifth one is acceptance. So this is how you are going to get questions in the exams. They may asking like fourth stage or fifth stage. What is the last stage of the Kubler and Ross stages of death, grieving? Then, so dash is an alteration in thought process that characterized by skipping from one topic to another unrelated topic. So this particular condition is thing there where they talk from one topic to the another, and it will not be not related to one thing. Sometimes they will be talking about food, sometimes they will be talking about politics, and the other time they will be talking about their siblings, and the other time about railway station, train, like that they will be talking. So this is an alteration in thought process. So what is this particular condition called? So those who are online, you can comment in the comment section. So what this can be? So this is called as the flight of ideas. So flight of ideas is a condition where the topics which they will be discussing, there will not be any connection. అంటే వాళ్ళు మాట్లాడుతున్న టాపిక్స్ ఒకదానికి ఒకటి సంబంధం లేకుండా ఉంటాయి అన్నమాట, అర్థమవుతుందా? సో there will not be any connection between the topics which they are talking, and that particular term is called as flight of ideas. Then the second one is la belle indifference. So the la belle indifference is the lack of concern for a profound disability such as blindness or paralysis that may occur in a patient who has a conversion disorder. See, it refers to an apparent lack of concern shown by some patients towards their own symptoms. So we'll be saying నీకున్న పర్టికులర్ నీకు ఏదైతే ఆ జబ్బు ఏదైతే ఉందో, whatever disease you are suffering from, you should be aware, you should be much more careful, but they will not be having any insight of the thing what is happening to them. We'll be saying because of your high sugar levels you are becoming blind, or due to a diabetic retinopathy you are means you are going to lose your vision, or sometimes in a conversion disorder where they will not have any physical symptoms. Ante somatoform disorders అని విన్నారా? ఇది వన్ టైప్ ఆఫ్ కన్వర్షన్ డిసార్డర్. సొమాటోఫార్మ్ డిసార్డర్స్ ఆర్ అంటే వాళ్ళకి ఫిజికల్గా దే విల్ బి షోయింగ్ సిమ్టమ్స్ లైక్ దే విల్ హ్యావ్ కన్వల్షన్స్, దే విల్ ఎగ్జిబిటింగ్ లైక్ seizures, like that they will show signs and symptoms. కానీ ఒకసారి మనం when we go through the investigations, when we perform any MRI or CT scan or whatever thing, there will not be any underlying pathology or pathophysiology. So that is called as labella indifference, where they will not have the insight of what condition those people are suffering from. And అంటే ఆ పర్టికులర్ సిమ్టమ్ ఉంది అని చెప్పేసి వాళ్ళు ఇగ్నోర్ చేస్తారు. ఓకే. Conversion disorder. In this disorder, the individuals experience neurological symptoms like weakness, paralysis, seizures, or difficult swallowing without any detectable neurological cause. So, the person will exhibit all these kinds and signs and symptoms where the person is not suffering. Like, they will exhibit symptoms like weakness. They will exhibit symptoms like weakness, paralysis, seizures, but there will not be any neurological disorder within them. Then moderate dash decreases a person's ability to perceive and concentrate. The person is selectively inattentive and focuses on immediate concerns, and the perceptual field narrows. So moderate ఈ పర్టికులర్ డిసీజ్ కండిషన్ ఎలాంటిదంటే ద పర్సన్ ఈజ్ అనేబుల్ టు పర్సీవ్ అండ్ కాన్సన్ట్రేట్. హీ విల్ నాట్ బి ఏబుల్ టు కాన్సన్ట్రేట్. హీ విల్ బి లైక్ సో మచ్ ఆఫ్ యాంగ్జైటీ. సో వెన్ దెర్ ఈస్ ఎ యాంగ్జైటీ ద పర్సన్ విల్ నాట్ బి ఏబుల్ టు పర్సీవ్ వాట్ ఈస్ హ్యాపెనింగ్. అంటే దే విల్ హ్యావ్ లైక్ అ పాల్పిటేషన్స్, దే వాంట్ టు డూ ద థింగ్స్ వెరీ వెరీ క్విక్లీ, ఫాస్ట్లీ లైక్ దట్. సో దే విల్ నాట్ బి ఏబుల్ టు కాన్సన్ట్రేట్. సో moderate anxiety. So this anxiety is of three types: mild, moderate, and severe. So in the moderate type of anxiety, the person will have decreased ability to perceive, and they will have decreased ability to concentrate. The person is inattentive. So whatever you are talking, and he will not focus on the immediate concerns. Immediate concerns ante the person might be surrounded within a serious situation, but he will not be focusing on the, he will be mainly focusing on the immediate concerns. Future lo em jarugutundo aa situation batti vallu aalochincharu, immediate concerns meede vallu focus chestaru. Then a patient who has a disorder, the screen is visible. Okay. A person who has a disorder uses self-protective avoidance as an ego defense mechanism. So, the person who is suffering from this type of fear, what is the other name of fear came anta manam? When we have any irrational fear about anything. So, what we call it as? What that particular disorder is called is irrational fear of things. అంటే అనవసరమైన భయాలు పెట్టుకోవడాన్ని ఏమంటారు? Yeah, exactly, Pagadalaruna. That's a supreme status phobia. So when the person has a phobic disorder, he uses self-protective avoidance as an, this is one kind of defense mechanism to protect themselves from that, to avoid that situation, this phobic disorder. In a patient who has dash, the highest treatment priority is correction of nutritional and electrolyte imbalances. Here we are talking about nutritional and electrolyte imbalances. So this is something related to eating disorder. So what kind of disorder is this? Eating disorder. Here I am talking about the eating disorder. Eating disorder, you might have heard about AN, BN. So what kind of disorder here we are talking about? So those who are online, you can comment in the section, comment section. So in a patient who has dash, has the highest treatment priority, correction of nutritional and electrolyte imbalances. So when the patient has anorexia nervosa, right, exactly, supreme status. So when the patient has this anorexia nervosa, these patients require nutritional and electrolyte imbalances, and this is one kind of eating disorder where the client will refuse, he will refuse, or inability to maintain the normal body weight. And that too they have this fear of gaining weight. I may gain weight if I may become fat by eating all kinds of food, like that will happen. Because of that there will be lots of weight gain, and they have false body perception about their body. I am looking fat అంటే అద్దంలో తను చూసుకున్నప్పుడు అనవసరమైన భయాలు, నేను చాలా లావుగా ఉన్నానేమో, లేకపోతే ఐఎమ్ అవుట్ ఆఫ్ షేప్ అను, లేకపోతే their refusal to acknowledge the seriousness of the problem or even that one exist. ఆ పర్టికులర్ ప్రాబ్లం లేకపోయినా అలాంటి ఉంది, ఒక అనరెక్సియా నర్వస్లో నాకు ఓవర్ వెయిట్ గెయిన్ ఉంది, అవుట్ ఆఫ్ షేప్ ఉన్నామని చెప్పి ఒక డిసార్డర్ అనేది ఉంటుంది. నెక్స్ట్, a patient who is taking lithium must undergo regular or usually once a month monitoring of blood lithium level, because the margin between therapeutic and toxic levels are is narrow. So what is the normal lithium levels? What is the normal lithium levels? Because ఇంకో 3 daysలో ఎగ్జామ్స్ ఉంది కాబట్టి ఆల్మోస్ట్ ఇప్పుడు అందరూ చెప్పగల సిచ్యువేషన్లో ఉన్నారు అనుకుంటున్నా. The normal lithium levels. What are the normal lithium levels? Because there is a difference between the, but no need to delete all the comments whatever you are posting. See, sometimes it may be right or sometimes it may be wrong. No need to correct yourself. Once you are posted, let it be like that. Don't need to delete all your answers, right? No wrong in making any mistakes. It means at least you are trying, you people are trying, you have come forward and you are listening to the class. Okay. So there are minute difference between the therapeutic level. Therapeutic is which will cure the patient, whereas toxic will cause toxic symptoms for the patient. So the normal laboratory value is, it is around 0.5 to, yes Sunish, 0.5 to 1.5 milliequivalents per liter, right? But sometimes what will happen, if it is more than 2 milliequivalents per milliequivalents per liter, it will cause toxic symptoms of lithium. Understood? So minute difference. So the patient who is on lithium therapy, they should get their levels checked once in a month. Now looking at the picture, you should guess. Early signs and symptoms of dash include anxiety, anorexia, tremors and insomnia. They may begin up to 8 hours after the last alcohol intake. Here I am talking about the alcohol intake. Early signs and symptoms of dash withdrawal include, so once they stop taking this alcohol, after 8 hours they will have these symptoms. So what kind of symptoms they will exhibit here? They will have anxiety, anorexia and tremors. They will have after the last episode of around 8 hours after the last alcohol intake. So what withdrawal they will have? Here you can see the image, right? So the patients who have this early signs and symptoms of alcohol withdrawal. So that is alcohol withdrawal include anxiety, anorexia, tremors and insomnia, and it will begin up to 8 hours after the last alcohol intake. Next, the nurse shouldn't exactly, Sunish, you are giving correct answer. The nurse shouldn't administer dash to a patient who has ingested alcohol because it may cause over sedation and respiratory depression. Here I am talking about one drug which starts from C. So we should not administer that particular drug to a patient when he has already ingested alcohol. Because of this particular drug, again the patient will get over sedation. Ante ఆల్రెడీ సెడేషన్ అంటే నిద్రమత్తులో అలా ఉంటారు. ఓవర్ సెడేషన్ రావచ్చు, ఇంకా రెస్పిరేటరీ డిప్రెషన్ కూడా రావచ్చు. సిటీ, గుడ్ ఆఫ్టర్నూన్, कैसे हो आप? So this is called as chlorpromazine. Chlorpromazine is the drug which should not be given when the patient has consumed alcohol, because it will cause respiratory depression. There will be relaxation of the diaphragmatic muscles, so that it will cause over sedation and respiratory depression. That is why they shouldn't consume chlorpromazine who has ingested alcohol. Then lithium toxicity can occur when dash and fluid intake are insufficient, causing lithium retention. I will give hints to you people. Okay. Now, lithium toxicity can occur. Here I am talking about one electrolyte. Here I am talking about electrolyte. That electrolyte name okay, I will give the electrolyte value 135 to 145 milliequivalents per liter. So lithium toxicity can occur when dash and fluid intake are insufficient, causing lithium retention. So what can be the electrolyte name here? No, potassium levels are almost 3.5 to 4.5. Yeah, supreme status you have told correctly. It is, I am talking about here sodium. I am talking about sodium. So when sodium and fluid intake are insufficient, it will cause, when the patient is not taking sodium and fluid intake, it will cause lithium retention, right? Exactly, Tamil Selvi, M. Pavitra Matam, K. Deepthi, Sunish, yeah, exactly, sodium. Very good. Then, an alcoholic who achieves sobriety is called a recovering alcoholic because dash for alcoholism exists. Here we are talking about, I am giving the option like, okay, I am giving the option, two options, whether it can be cured or there is no cure for alcoholism. Which one you will prefer? So this is the 17th slide I am explaining. So you can put in the comment section like 17A, 17B. An alcoholic who achieves sobriety. Sobriety means the person who is already alcoholic and he wants to stop alcohol. What he will do? Slowly he will stop taking the consumption of alcohol, consuming alcohol. So it will be like 1 year sober. For example, even celebrities, Pooja Bhatt, I think so. She has come to the social media saying that now I am 5 years sober. It means 5 years sober, 7 years sober. Here the word sobriety you can find it here. So 5 years sober, 6 years sober means they are recovering from alcohol. So whether there is a cure for alcohol exists or not, because there is no cure for alcohol. So the answer is there is no cure for alcohol. So the patient will be always in the recovering alcoholic phase because there is no cure for alcoholism. Okay. Here we are talking about, according to the Erikson, the school age child ages 6 to 12 is in the dash of psychosocial development. So you might have heard about this Erikson's psychosocial development. So in that ages 6 to 12, this particular age group, they have one I versus I. So what is that I versus I? I have also given you hint, I versus I. So that particular psychosocial development stage is called what? According to the Erikson, the school age children between ages 6 to 12. So that is industry, exactly, that is industry versus inferiority. So they will be very, very studious, or whatever activities these school children will be carrying out now, they want to do that activity and they want to show their achievements. Mummy, see, I have participated in poem recitation program today. Today I have participated in the skit and I was praised by all my teachers, my friends, my classmates were saying so good about it. This is called as industry. So once this particular stage they are not able to achieve, they will get inferiority complex. Inferiority. They will be feeling very low and they will get this inferiority complex. So this is called as Erikson stage, which we will see in ages 6 to 12. When caring for a depressed patient, the nurse's priority is safety because the increased risk of dash. When you are caring for a patient who has got depression, so what is the most what to say, depression lo ఉన్న client ఏం చేసుకుంటారనే భయం అనుకుంటది. When caring for a depressed patient, the nurse priority, what will be the nurse priority regarding the safety of the increased risk of dash. So what can be this one? So that particular diagnosis, not diagnosis, okay. So it starts with the letter S, depression patient. Yeah, exactly. So that is suicide. So when we are caring for a depressed patient, the nurse's safety. So safety because there is increased risk of suicide. Now, suicidal, Pagadala Aruna and Deepika Gona, exactly. Suicidal, city suicidal and supreme status, exactly good. Now, dash is parrot-like repetition of another person's words or phrases. So what can be this particular diagnosis? It starts with E. Dash is parrot-like repetition. Those who are 13 online, you please, okay. Monica Andavarapu. So, Monica Andavarapu, correct ga cheppavamma. Monica and M Pavitra, you are told. That is echolalia. Echolalia is repetition of the another person words or phrases. If I am asking, where are you going? I am going to Hyderabad. So, he will be saying, I am going to Hyderabad. Are you reading newspaper? He will be saying, I am reading newspaper. So, echolalia is a parrot-like repetition of another person's words or phrases. Then, according to psychoanalytic theory, this is the dash is part of the psyche that controls internal demands and interacts with the outside world at the conscious, preconscious and unconscious level. Here I am talking about in the psychoanalytic theory. So, in the psychoanalytic theory, we have these three parts. What are those? Id, ego and superego, right? So, according to the psychoanalytic theory, dash is the part of the psyche that controls internal demands and interacts with the outside world. So, here we are talking about ego. So, this is the part that controls our internal demands. See, there are basically three levels of id, ego and superego, which I will tell now. So, according to this question, the ego is the part of the psyche. It really controls our internal demands and it interacts with the outside world on three bases: conscious, preconscious and unconscious levels. Then, again, according to the psychoanalytic theory, the dash is the part of psyche that's composed of morals, values and ethics. It continually evaluates thoughts and actions, rewarding the good and punishing the bad, thinking of the superego as the super cop of the unconscious. So, here I told about psychoanalytic theory. So, from the psychoanalytic theory, here it continuously rewards for the good and punishing the bad. So, this is here we are talking about superego. Here we are talking about superego. So, superego ni ela gurtu pettukovalante, superego is a super cop of the unconscious. Let me tell you. Okay. So, this if you look at this psychoanalytic theory, this is the structural theory of mind and primarily thinking of this id, ego and superego. So, id is something, this is pleasure seeking principle. So, it is not bothered about the reality. For example, I have one my favorite food, rasmalai or biryani in front of me. So my id thinking, what it will say, go eat immediately. It's your most favorite food. Rasmalai is most favorite. Do forget that your sugars will be high, or your put on, you will wait. Like that, id is something pleasure seeking. It is the pleasure seeking. It will immediately go for gratification. Whereas superego is something, it is super cop or super conscious. Super cop or super conscious, but the super ego will tell what? If you are eating rasmalai or biryani of your favorite, definitely you are going to put weight. So be conscious. Already, whatever the apron you are wearing, it's already tight. And again, upon that, you are preferring this type of foods. Again, you will put on weight like that. My super ego will indicate me, or it will give signal to me, do not eat like this type of junk food. It is a pleasure seeking. Super ego will indicate, it's like our angel thinking, devil thinking will be there na. So it's like a devil thinking part. I am just saying for the example purpose, don't completely think on this way. So super ego will give reminder to you. It will tell what is good, what is bad. Whereas id is a pleasure seeking. And ego is something, it's a reality principle. It will balance both. Understood? So in the ego, we use this, we will use what? Our defense mechanism. Defense mechanism untai kada, suppression, sublimation, projection. So all this does defense mechanism, we will use it in the ego. So this ego is primarily determined by the experience of reality. So ego is mostly based on the reality purpose. You are not supposed to eat, you have to maintain a healthy weight. So that is the ego. So understood the id, ego, super ego? Then, so according to the psychoanalytic theory, this is the part of psych that contains instinctual drives. Instinctual drives ante appadikappudu cheseyalanipichedi. Idi idda lepothe ego na super ego na? Edi cheppandi. Instinctual drives ante you want to prefer, I want to do it, whether it is id, ego or super ego. Are you able to understand what I am trying to say here? Instinctual drives. Here I have told about instinctual drives. So if you want to remember this, you should say it is id, I. Then, dash is the defense mechanism used by a patient who denies the reality of an event. So, this particular this question is something related to our first slide. What was my first slide? Dash is the defense mechanism by a patient who denies the reality of an event. Here he cannot accept the fact what is happening around him. So he or she might be saying, this is the terminal stage of cancer, this is the last stage, you have liver issues, you have this renal issues, you have cardiac disorder, so this is your last chance, so you will not be able to survive for more than 4 months. So at that time the first stage of grief arrives. So what is that one? 15 members, are you there online? So this particular defense mechanism is called as denial. So denial is the defense mechanism used by patients who cannot, is a defense mechanism who denies the reality of an event. Then, in a psychiatric setting, dash is used to reduce overwhelming environmental stimulation. See, in psychiatric wards and all, or in normal wards also, when we come to know about the diagnosis of the patient like HbSAg positive, HCV, HIV, HbSAg, or any kind of retropositive cases, what we will do, we will put them in a isolation, right? When we are putting them in isolation, so what that particular term is called? Why we put them in isolation? To prevent self injury, or there may be chances that if they are overly stimulated in a general ward, definitely the patients will be overly stimulated. How? Either the doctor or the nurses in the process of history collection or drawing samples, what we will do, frequently we will be interacting with the patient. Sometimes the patient will be aggressive. So in that process, either he will harm himself, ఒకటే తనను తాను ఇంజరీ చేసుకోగలడు, లేకపోతే ఇంకొకరిని ఇంజరీ చేయగలడు. సో అలాంటి ప్లేసెస్లో మనం ఏం చేయాలంటే పేషెంట్ని seclusion. So that particular term is called as seclusion is the word used to reduce the overwhelming environment. Are these words new to you? Yes or no? Okay. Then tyramine rich foods such as aged cheese, chicken liver, avocados, bananas, meat, tenderizers, salami, bologna, Chianti wine and beer may cause severe dash in a patient who takes a monoamine oxidase inhibitor. See, when the patient who is already on treatment of monoamine oxidase MOAI, monoamine oxidase inhibitor, they should avoid foods which are rich in tyramine. Tyramine is one type of amino acid. This is one type of amino acid called tyramine. So this is a naturally occurring tyramine. Mostly we will find it in the aged cheese or chicken liver, avocados or bananas or processed meat and homemade wine, home brewed wine antar kada. Alanti cases lo we will have this tyramine rich element. So when the patient is on MOI and upon that if you are giving them this type of food, it will cause hypertension crisis. So the patient may have chances of getting hypertension crisis. So all of you, from which places you are? Are you on duty? Are you off duty? How have you taken leave for preparing for your ESA exams? Or at your home? Or who is watching my channel from the duty or from home? Let me know in the comment section. Okay. A patient who takes MOAI inhibitor should be weighed bi-weekly and monitored for tendencies. So the patient who is on this MOI, so weekly twice we should check the patient weight. For what tendencies? So to prevent this suicidal tendencies. So the patient who is on MOI, we should check their weight daily and also we should also check the patient for any suicidal tendencies. Next, a patient who takes a monoamine oxidase inhibitor has palpitations, headaches or severe orthostatic dash. The nurse should withhold the drug and notify the physician. So what I am talking about here, orthostatic what? This is a common term when there is a decreased blood pressure. So already when the patient has this on this particular medication and the patient has palpitations. Palpitations enti మన హార్ట్ బీట్ కొట్టుకునేది మనకి ఓన్గా తెలుస్తూ ఉంటుంది. ఇట్ విల్ బి కంప్లీట్లీ ఆడిబుల్ టు ద ఓన్ సెల్ఫ్ పర్సన్. సో ఇట్ విల్ కాజ్ వాట్? ఇట్ విల్ కాజ్ orthostatic hypotension. So when the person is suddenly from the sitting position, when he comes to a standing position, there will be sudden drop in the blood pressure. Sudden drop in the blood pressure, that is called as orthostatic hypotension. Are you able to listen, understand the class? Okay. Common causes of dash are poor impulse control by the parents and lack of knowledge of growth and development. So what are the common causes of this is one kind of abuse I am talking about. See, when the parents don't know how to raise their kids, what will happen? The common type of abuse on children, what is that term called, the terminology? Okay, good afternoon. Oh, all of you have answered. My comment section frozen and I was unable to see all your comments. Nice. Okay, good. Okay, Suryanish, hypotension, city hypotension, Suryanish, okay. So the common causes of dash are poor impulse control by the parents. So when the common cause of this, child abuse and poor impulse control, ante when the parents are unable to control their temperament, or they don't know the how to raise a children at that places, we can commonly see in this what we will see this child abuse, where children are not treated by the parent, and but like parents will be addicted to alcohol, they will not be treating the children properly, not feeding them, not taking care of them, not sending, అంటే ఒక child కి కావాల్సిన నీడ్స్ అంతా ఆ పేరెంట్స్ ఫుల్ఫిల్ చేయలేరు. దట్ ఈస్ కాల్డ్ యాజ్ అ చైల్డ్ అబ్యూస్. Next, the diagnosis of dash disease is based on clinical findings of 2 or more cognitive deficits. Here I am talking about one memory related disorder. It's a neuro disorder. It starts with the letter A, where they are forgetting everything. So it is based on the clinical findings of cognitive deficits. So suddenly they will be like forget everything. They will be walking on the road and they will forget where am I, who am I, why, actually where I am going, like that. So and the results of a and like that 2 to 3 episodes will happen. That is amnesia is forgetting. Okay, exact diagnosis, the other name of so dementia is one type of this particular disorder. Yeah, M. Pavitra, you told correctly. So this is, we are talking about Alzheimer's disease. Here we are talking about Alzheimer's disease. Next, memory disturbance is a classic sign of, just now we are we are talking about this particular disease now. So memory disturbance is a classical sign of our Alzheimer's disease. Then dash blocking is loss of the train of thought because of a defect in mental processing. So dash blocking, so dash blocking is loss of the train of thought because of a defect in the mental processing. So whatever they're thinking, that particular thinking is completely blocked. Yes, Divya Konda, you told correctly. So that is called as thought blocking. Next, 35th slide. Okay. A dash is an irresistible urge to perform an irrational act, such as walking in a clockwise circle before leaving a room or washing the hands repeatedly. Yes, Divya, Sunish, you have told correctly. Dash is an irresistible urge to perform an irrational act of walking. Okay, see, we can tell OCD, one is obsession, C is compulsion. So obsessive compulsive disorder, obsession is the repetitive thoughts. ఏవైతే repetitive thoughts ని మనం obsession అంటాం. Compulsion is implementing, like checking the door. Compulsion of the, here C stands for compulsion. Compulsion means they want to do, they want to check the door repeatedly, they want to wash their hands repeatedly, they want to take bath frequently, and they want to clean everything. So compulsion is the doing thing, obsession is the here thinking process, obsession is repeated thoughts, compulsion is danni act chesi fulfill cheyadame. So OCD, here we are talking about one part of the diagnosis, that is a compulsion is a, so compulsion is a irresistible urge, అది చేయకపోతే ఇంకా మనం ఉండలేము, అది చేసి తీరాలి అన్నట్టు ఉంటారు వాళ్ళు. Next, a patient who has chosen a method and a plan to commit suicide in the next 48 to 72 hours is at high risk for suicide. So the person who has already chosen a method, a plan to commit suicide, means he has come to a conclusion that okay, I will choose this method of killing myself, means within 48 to 72 hours they will implement that particular task, and they are very high risk for suicide. Okay. The therapeutic serum level of lithium is dash milliequivalents per liter. Already మన previous slides లో చెప్పుకున్నాం ఇది. So what is the therapeutic level for lithium? The previous slides I have discussed. The therapeutic lithium levels. The 27 members who are online, Yeah, Jamala Sirisha. Yes, that is 0.5 to 1.5 milliequivalents per liter. See, all the bullets point I have taken from this NCLEX book. So, these values will be more towards this NCLEX book values, right? Okay. Phobic disorders are treated with dash therapy, which gradually exposes a patient to an anxiety producing stimulus. Very, very good. Tamil Selvis, Sunish Pagadala Aruna, very good. Okay. Phobic disorders are treated with dash therapy, which gradually exposes a patient to an anxiety producing stimulus. So, here you can see the image, right? So, ikkada chustunna image ni batti already the patient is afraid of spider. He is afraid of the spider, and here this lady is exposing him to his fears. So, this is one kind of therapy. What is this therapy name? It starts with the word D. Here it starts with the word D. So, phobic disorders are treated with dash therapy, which gradually exposes. So, it is a desensitization. So, this particular process is called as desensitization. The person is afraid of that particular thing and he is on therapy of losing fear of that one. So, that particular process is called as desensitization. Next, dysfunctional grieving is absent or prolonged. So, this is our first slide. This particular thing is going to our first slide. Or dysfunctional grieving is absent or prolonged grief. Yes, it's desensitization. Okay. In previous class, I have talked about this interpersonal relationship. Peplo, she is an American nurse. She has developed this interpersonal relationship. So, here we are talking about the first, we are talking about the stages. So, in this particular stage of nurse-patient relationship, so this particular stage is orientation phase. Okay. Orientation phase, the nurse obtains an initial history and the nurse-patient agree for a contract. So, here this is the orientation phase, whether it is a first stage, second stage, or which phase is this one? Which phase is this? Here the question is about during the phase 1, 2, 3 or 4. Orientation phase where both nurse as well as patient, yes Sirisha, yes you are correct. So, this is during phase 1, that is orientation phase. Excuse me. So, during phase dash of the nurse-patient relationship, so this is called as a middle or working phase. So, this is called as a middle or working phase. The patient discusses, here the patient opens about and he starts discussing his problems, his behavioral changes, and self-defeating behavior is resolved or reduced. Here it is reduced. This problem is reduced. So, this is during phase 2. So, this is during phase 2. And this is the last phase of the nurse-patient relationship, where the termination or resolution phase we call it as. Here the nurse terminates the therapeutic relationship and gives a positive feedback on his accomplishments. So, here the nurse gives a positive feedback on the patient's accomplishments. So, what phase is this of this interpersonal relationship? So, this is called as the third phase. Next. So, we are on the 44th slide. According to Freud, a person between the ages 12 and 20 is in the dash during which he learns independence and has an increased interest in the members of the opposite sex and establishes an identity. So, according to Sigmund Freud, see, psychosexual theory, Sigmund Freud has developed the psychosexual theory where he had told about oral, anal, phallic, latency and genital stage. So, according to his theory, the oral stage will be achieved by the babies, where they will be most of the time their developments, oral development will be on drinking milk, and their pleasure seeking area is their mouth. And in the second stage, they will be like more concentrating on the bowel control and bladder control, that is called as oral anal stage, phallic stage, latency stage, genital stage. So, here we are talking about the age group of 12 and 20, and here the members of interest are the opposite sex. So, which particular stage is this? Oral anal phallic latency or genital stage? It's a genital stage, exactly, Siddhi. So, this is the genital stage, where they will be attracted to their opposite sex. So, is the class okay in English, or shall I take in Telugu? So, according to Erickson, the identity versus role confusion stage occurs between ages of dash and dash. So, just now the before slide we have discussed that particular age group. What age group was that? So, here I am talking about the age group. Identity versus role confusion. Identity versus role confusion. So, identity versus role confusion means here is in this particular age group, they exactly know what they want to. During this phase of intermediate stage or 10th stage, there will be like kind of confusion whether I should select a mathematics group or science group or arts group. Like that way, there will be confusion. That's and once they know, okay, I want to do my triple or I want to do a join science group, where I can, in the science group, I can go into either MBBS or I can go into nursing or D pharmacy, B pharmacy. So, that particular is the identity group. Whereas, once they do not know what they want to achieve, they will come into the role confusion stage. So, what is this particular stage? So, this is a age 12 to 20. For the 12 to 20, according to the Erickson, this is identity versus role confusion. मैम मैं यूपी से हूँ, मुझे तेलुगु समझ में नहीं आती, इसलिए तो मैं क्लास इंग्लिश में कंटिन्यू कर रही हूँ. Okay, the class will be in English. Okay, a patient with a dash personality disorders exhibits suspicion, hypervigilance and hostility towards others. So, this is a one particular disorder where the patient will have hyper suspicion. So, other name of this suspicion, suspicion, hypervigilance, hostility. Suspicions means, hypervigilance means overly protective. Even for a minimum thing, they will expect more from their partner, their friend or husband or anybody. They will be hypervigilant. You belong to me, like that. More suspicious type. What is this particular disorder? So, this is a paranoid disorder where they exhibit suspicion, hypervigilance and hostility. Hostility is not being friendly, and suspicion is it is a one kind of paranoid disorder. So, here we are talking about this suspicion, hypervigilance and hostility. So, if you look at this paranoid disorder, it is of these categories: category A, category B and category C. So, in the category A, again it has been classified into paranoid schizotypal, schizoid personality disorder, and category B, again it has many types like dramatic, emotional, erratic, antisocial, borderline. So, all these things comes under this paranoid disorder. So, dash is the third leading cause of death among teenagers. So, this particular diagnosis is a very third leading cause among this white teenagers, and that is, so that is a suicide. Then, most teenagers who kill themselves made a previous attempt and left a telltale signs of their plans. So the teenage people who have already killed themselves, they have made attempts of this committing suicide previous time, but the last time they will be completely successful. So by looking at the signs and symptoms, we can say, okay, only we were the people who are unable to కమ్ టు ఎ కంక్లూజన్. అంటే మనం కనుక్కోలేకపోయాము ఈ పర్సన్ ఆల్రెడీ సూసైడ్ చేసుకోవడానికి ట్రై చేశాడు, కాకపోతే మనం అది కనుక్కోలేకపోయాం అనేది. ఓకే, in Erickson's stage of generativity versus despair, so generativity investment of the self in the interest of the larger community is expressed through procreation, work, community services and creative endeavors. So if you look at this Erickson developmental stage, psychosocial stages, so here we are talking about this generativity and despair. So in this type of psychosocial stage, so at the age of this 30 to 64 or 65 onwards, they will be mostly on contribute to society and to be a part of the family and assess to make sense of life, meaning contributions. There will be most of the time, there will be like accomplishment of things. They will be mostly like the procreation, taking care of their children and thinking about their settlement, and they will be more community service oriented and creative endeavors, and which will be helpful for the society, their friends, family, like that they will be living. So this is the last stage, generativity versus despair. Okay, Monica Andavarapu, ma'am, in therapeutic relationship, pre-interaction phase or orientation phase is the first phase. You are right. So whatever the content I have taken, Nama, this is from that particular NCLEX related. I think there should be correction in this one. The thing you point, you are told correct. Maybe that particular slide has come out to be mistake. Okay. Alcoholics Anonymous recommendations a program to achieve sobriety. So they will be in alcoholic recovery phase. So they have one few steps of this achieving this sobriety. So here I am asking about the steps A, B, C, D. So whether it is a 5-step process, 10-step or 12, or it is a 9-step process. What could be the answer here? Alcoholics Anonymous recommendations a dash program to achieve sobriety. So this is our 52nd slide. Okay, those who are online, please comment in the comment section. So how many steps are in this sobriety program? 5, 10, 12 or 9? Okay, 52 you are saying it as 9. Okay, Jamala Sirisha is saying, okay, city, no idea. Okay, so it is a 12-stage program. So it is a 12-step program. Okay. Signs and symptoms of, here by looking at the picture you can tell me the diagnosis. Signs and symptoms of dash include amenorrhea, excessive weight loss, Lanago, fine body hair, abdominal distension and electrolyte disturbances. What can be the diagnosis of this one? 1 second, I will come, give me a break. Oh, exactly. Everybody has given their correct answer. Yes, this is anorexia nervosa. Next, a serum lithium level that exceeds dash is considered toxic. At which level the lithium levels are considered toxic? I told now 0.5 to 1.5 is therapeutic. At which level we will consider that particular value as a toxic? So that is 2 milliequivalents per liter. Yes, 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 yes. Supreme status, Santu Gurram, Tamil Selvi. Yeah, okay, good. Okay. The nurse should suspect dash in a young child who has blood in the feces or urine, penile or vaginal discharge, genital trauma that isn't readily explained, or a sexually transmitted disease. Here I am talking about one kind of abuse where you can find blood discharge in their feces or urine, or on the penis of the male child, or on the, if the female child has a vaginal discharge or a genital trauma. At that time this particular abuse is called as what? So this particular abuse is called as the child abuse. These are the signs and symptoms of child abuse. So an alcoholic uses dash to cope up with the stresses of life. Already the person is alcoholic. So again, what method you will choose to cope up with the stress in life? Already he is an alcoholic person, and what method he will choose? So again he will choose method of, definitely he will be choosing the method of alcohol only. So an alcoholic person will choose again the alcohol for losing the stress in his life. Next, the human personality operates on dash levels, conscious. So here I have mentioned the levels, so you can answer now. So human personality operates on which levels? Conscious, pre-conscious and unconscious. So how many levels are here? A, B, C, D. Okay. Whether it is 3, it is 3 or 2 or 4 or 1. Which one? So the human personality operates on how many levels? So it operates on 3 levels. Next one. Okay. Okay, so most of you have given Dakshayani, Daku, Supreme City. So 3 levels is the answer. Option A is the answer, exactly. So asking a patient and dash is one of the best ways to elicit or clarify information. See, whenever we are asking any number of questions to anyone, we are expecting more explanation from them. So we will be asking them either open-ended questions or we will be asking them closed-ended questions. So here, according to the question, asking a patient one of the best way to elicit or clarify information. So which one will be? Whether it is option A or option B. Open-ended questions will clarify the information or closed-ended. Yes, Supreme, Purnima. Yes, it's always the open-ended questions will clarify most of our doubts. So the open-ended questions will be like this. What do you see your life in 10 years time? What do you think your best qualities? What do you think your worst qualities? What's your biggest pet peeve? What is your favorite? Like that, we will be asking them questions so that they will be explaining themselves more. Next, now looking at the symbol, now tell me what is this particular diagnosis? The diagnosis of dash is often made when a child is 2 to 3 years of age. When the child is 2 to 3 years of age, we can make this diagnosis. So this particular symbol is related to that. AIDS, AIDS key symbol, okay. Autism, autism. Prama Chatterjee, cancer. Okay. Yes, the answer is this is here I am talking about autism. So autism we can find out at the age of 3. If you look at the signs and symptoms of this autism, no. So the autism mostly these children will have very marked impairment of social and interpersonal interaction. They will not give eye to eye contact when you are talking to them. They will not have lack of attachment to the parents, and they will not have this separation anxiety. Even at 6 months of age, when you try to separate a baby from her mother, they will have this separation anxiety. Like that, the same way with this 2 to 3 years of age child, when you bring the child away from the parents, they will not be like worried or they will not be crying. Means they will not be much emotionally attached to their parents, and they definitely have making problem with their friends, and they have limitative behaviors, and they have absent social smile. They have lack of awareness of others' existence or feelings, and treats people as furniture. And say meeku aa table ki aa chair ki valku peddaga farka padadu. And they have no or abnormal social play. They always prefer solitary games. They will play in isolation single, and they do not have absence of fear in the presence of danger. If they see any what to say dog or snake running towards them, they will not be afraid. So there will be like absence of fear. So all these things we will see in whom? We will see in this autism. Okay. Defense mechanism protect the personality by reducing. So due to some problem, we use this defense mechanism in our ego, right? So what is that? मैम ऑटिज्म ट्रीट हो सकता है, ऑटिज्म को ट्रीटमेंट हो सकता है, पर बहुत सारा पर्सनल सुपरविजन करना पड़ता है बच्चों को, मतलब बहुत ध्यान से उनका ट्रीटमेंट देना पड़ता है. So this defense mechanism protect the personality by reducing the stress and anxiety. Next. Dash is voluntary exclusion of stress producing thoughts from the consciousness. So this is a one type of defense mechanism which we will suppress, which will be trying to avoid the painful situations in our life. That particular defense mechanism, that is. Yes, Purnima, Manjunath, very, very good. So yes, that is suppression. ఆ పెయిన్ఫుల్ థాట్స్ని ఆల్రెడీ మనకి ఒక బ్యాడ్ ఎక్స్పీరియన్స్ జరిగింది. ఆ పాటు ఒక సినిమా థియేటర్కి వెళ్ళాం. సో ఆ సినిమా థియేటర్కి వెళ్తే మనకి టికెట్స్ సరిగ్గా దొరకలేదు, మూవీ బాగా చూడలేదు, అట్లా వాష్రూమ్స్ బాగాలేవు, అక్కడ ఫుడ్ బాగాలేదు. సో అగైన్ మనం వేరే థియేటర్కి వెళ్ళినప్పుడు ఆ పర్టికులర్ సినిమా మూవీ థియేటర్ గురించి మనం ఆలోచించమన్నమాట. సో దట్ ఈస్ సప్రెషన్. So in psychodrama, life is situations are approximated in a structured environmental, allowing the participant to recreate and enact the scenes. So here this is the psychodrama. This is one kind of therapy which has been practiced in many countries, where whatever the problems they are facing, they will enact. Then a situation ne act chesi vallu chupichi, they will try to recover from them. So this is called as psychodrama. I have a video for this. हाँ ESI में ट्रीटमेंट अच्छी है, आप चाहे तो दिखा सकते हो सिटी. Here I have video for you. I will show you. Means this is a one from movie. I am just trying to show you. See how that hero is enacting the situation. You can see the Tamil how she is enacting like that. So here talking about psychodrama, where they will recreate and enact scenes. ఆ పర్టికులర్ వీడియో ఏదో చూపించాను. దస్ ఈస్ సీన్ ఫ్రమ్ తమిళ్ మూవీ. నెక్స్ట్, A patient who is taking dash must avoid ingesting products that contain alcohol such as cough syrup, fruit cake and sauce and soups made with cooking wine. See, the patient who is taking this disulfiram. So, when the patient is taking disulfiram, he must avoid foods which contain alcohol, like cough syrup, fruit cake, because cough syrup they contain the minimum amount of alcohol is there, and fruit cake sometimes they dip in the alcohol and they prepare the fruit cakes, and some kind of sauce and soups they are mixed with this, they are made with this cooking wine. So, the patient who is on disulfiram therapy, they should be away from cough syrups, fruit cakes and sausages and soups. A patient who is admitted to a psychiatric hospital involuntarily loses the right to sign out against medical advice. See, when the patient, psychiatric patient is a lunatic patient, when he is getting admitted in the hospital, definitely they will be getting admitted in the presence of either their relatives, family members or caretakers. They will be the in charge, or the doctor will decide what kind of procedure is suitable for them, and they themselves are not in a situation to give consent about themselves. Means if you are planning electroconvulsive therapy, you are planning to give shock to the patient, at that time they will not be in a situation for their own in person. A patient who constantly seeks approval or assistance from staff members and other patients is demonstrating dash behavior. So, what kind of behavior is this? Whether it is dependent behavior or independent behavior. So, this is 70th slide, tell me. So, here the patient is constantly, he is seeking, means he is getting approval or assistance from staff or staff members or other patients and demonstrating this kind of behavior, whether it is a dependent or independent. Yes, it is an dependent behavior. He is constantly depending on others. Then, signs of lithium toxicity include diarrhea, tremors, nausea, ataxia and confusion. So, already we are told regarding this toxic levels, more than 2 milliequivalents per liter, it will cause diarrhea to the patient. They have tremors, shaking, nausea feeling, muscle weakness and ataxia. What is ataxia? So, ataxia is a condition where they are walking gait. So, it is a poor muscle coordination and clumsy movements. So, it will mainly, the patient will not be walking, the patient will not be able to walk in a balanced way, and we can find this ataxia even in cases of cerebellum injury. In cerebellum injury also we will find this ataxia condition. So, tremors, nausea, vomiting, everything we can see in the lithium toxicity. Next, a dash effect is characterized by rapid shifts of emotions and moods. So, this particular condition is where, for example, when there is a funeral already going on, means there is a death, everybody is crying, but that person will have, what kind of effect he will have means, they will be like, they will not be crying, they will be extremely laughing like anything. So, this is called as inappropriate effect, or this is called as labile effect. So, this is called as the labile effect. Dash is loss of memory from an organic or inorganic cause. So, loss of memory ki manam cheppunnam kada indaka term. This is not Alzheimer's. This is a term which is called lack of memory. What is this particular term? Lack of memory. Those who are online, comment. So, this lack of memory, so this is called as amnesia. Purnima Manjunath, yes. Suryanish Sunish, yes. Next, A person who has this BPS disorder is demanding, judgmental in interpersonal relationships, and will attempt to split staff by pointing to discrepancies in the treatment plan. So, this is one type of personality disorder. This is a one kind of personality disorder where he will be like attempt to split staff, they are pointing out his discrepancies in the treatment plan. So, this particular thing is called as, that is called as borderline personality disorder. Next, disulfiram shouldn't be concurrently with, it should not be taken along with this type of medication, because they may interact and cause psychotic reaction. Here I am talking about the drug, other name is Flagyl. So, the other name of this particular drug is what? So, disulfiram shouldn't be taken with that particular drug, otherwise it will cause psychotic reaction in the patient. Flagyl ante inko name enti? Disulfiram is a drug, whenever he is trying to take ethanol, it will be converted into acetaldehyde and finally the byproduct will be acetate. So, again the patient will have these signs and symptoms. So, it should not be taken with Monica Andavarapu writes. So, it should not be taken with the metronidazole, Flagyl or metronidazole. Next, in rare cases, dash therapy causes arrhythmias and death. In severe depression cases, we will go with one kind of therapy. One kind of, that is that therapy. Full form of this therapy, tell me, what is this kind of therapy? Bilateral, unilateral therapy we call it as. Yes, that is electroconvulsive therapy. A patient who is scheduled for electroconvulsive therapy should receive nothing by mouth or nil per oral to prevent aspiration under anesthesia, because we will be voluntarily inducing seizures for the patient or convulsions to the patient. When the patient is NBM, so there will not be any chances of aspiration. If the patient is eating food and we are going for this ECT therapy, what will happen? There will be chances of food particle aspiration. That is why the patient should be on strict NPO under anesthesia. Next. So, electroconvulsive therapy is used for patients who have dash doesn't respond to drug therapy. Just now I have told, they will have this particular diagnosis. So, because of this diagnosis, they usually they don't respond to drug therapy. For those patients only we will give this ECT therapy. The tablets ki vallu respond avaru. Yes. So, that is depression. So, depression patients will not respond to drugs. Then only we will go with this one. And so, this electroconvulsive therapy will be effective for the patients who receive 6 to 12 treatments at the rate of 2 to 3 per week. So, around 12 treatments we will be giving, and that too how many? So, in a week how many times? In a week around 2 to 3 times. So, within a week when we will be giving 2 to 3 times, around 6 to 12 treatments are necessary for this ECT. Next, during the manic phase of bipolar affective disorder, nursing care is directed at the dash the patient down, because the patient may die because of self-induced exhaustion or injury. So, already it is a manic phase. So, during the manic phase, we should be directed at the dash the patient, whether we should be whether it is options is like very fast progressive, or it should be in a slowing the patient down. Which one? already he has the manic phase. So, the nursing care should be to make the patient fast, because he is already trying to, they will be in the process of self exhaustion or self inflicted injury. Yes, we should be on the main focus should be on slowing down the patient. Next. For a patient with Alzheimer's disease, the nursing plan should focus on what kind of measures? So, what kind of measures we should focus on? On hazardous or on safety measures? So, the way mainly these patients have this sundown syndrome. Evening times their symptoms will be more worse. They will be wandering tendencies. They will be wandering in the corridor at the home during the night time, and near the steps they will fall down because their visual will be much less. So, we will be mainly focusing on the Purnima Manjuna Tamil Selvi. Correcta சொன்னீங்கப்பா. So, that is we will be mainly focusing on the safety measures. Okay. After dash assault, the patient needs are primary concern followed by medico-legal considerations. So, when the patient has gone through that kind of assault, main focus should be on the patient needs, not on the MLC considerations. MLC considerations important కాదు మనకి ఇక్కడ ఆ particular assault తర్వాత, but patient needs is most. So, what kind of assault is that? What kind of assault it can be? So, it is a sexual assault. So, in that sexual assault, our focus should be main on the patient needs. Exactly, Pasha. Punima Manjunath, P. Swati, yes, exactly. Okay, patients who are in maintenance program for narcotic abstinence syndrome, they should receive 10 to 40 mg of this particular drug in a single daily dose and are monitored to ensure that the drug is taken by them. So, the drug other name is Dolofil. So, what can be this drug name? So, 10 to 40 mg of this particular drug should be taken by them. So, what is that drug name? So, that is called as methadone. Okay. Now, this particular question is related to you. You people are under more this kind of thing. Dash management is a short range goal of psychotherapy, because in few more days you people are going to write ESIC exam. So, what management is more? You people should tell me. It starts with the letter S. So, here we are talking about stress management is a short range goal for psychotherapy. Yes, yes, Pasha and Monica. Others? Okay. The mood most often experienced by a patient with organic brain syndrome is what? So, the patient who is already suffering with organic brain syndrome, whether the patient will be calm and peaceful or the patient will be irritable. This is 88th slide. 88th slide. So, whether the patient will be calm and peaceful or the patient will be irritable. The mood experienced by a patient with organic brain syndrome. So, here the patient will be, there will be chances of more of irritability. Irritable, P. Swati, exactly. Okay. Creative intuition is controlled by the right side of the brain. Creative intuition. Creative intuition means sometimes you are searching answer for some question. So just now I told one mistake answer like this: interpersonal relationship. One girl has pointed out, my madam, that particular pre-orientation phase like that you have told, no madam, that particular question is wrong. So, I am doing cooking and suddenly I have realized, yes, that particular question was wrong. That is called as the creative intuition, means suddenly getting the correct thoughts in your brain. So, creative intuition is a secret friend, that is a voice in your head that whispers brilliant ideas. So, this is a voice in your head that will whisper brilliant ideas when you are washing dishes or when you are taking shower. Suddenly you will realize, that particular day after exam you might have realized, oh, ఆ క్వశ్చన్కి ఈ ఆన్సర్ కాదు కదా, ఈ క్వశ్చన్కి ఇది కదా ఆన్సర్ అని సడన్గా బ్రిలియంట్ ఐడియాస్ రావడం అనమాట. Okay, dash is the general anesthetic that's administered to patient who are scheduled for ECT therapy. So, the other name of that particular drug is Brevital. So, it is also called as metohexital. Metohexital is the general anesthetic. So, this is the general anesthetic. So, which is administered to patients who are posted for ECT. Next. So, can you see the images here? The decision to use dash should be based on patient's safety needs. If you look at this image, you can understand. What is this? So, every 24 hours we must, after 24 hours we should get consent to tie this one, especially for the aggressive patients or the, yes, exactly Purnima. So, when restraints, these are called as restraints, especially in children when they have undergone any cleft lip surgery or any eczema cases, when they shouldn't scratch their skin after surgery, suture line they shouldn't scratch, so they will put hand mitt for that patients. So, elbow restraints, knee restraints, vest restraints, these are called as vest restraints, elbow restraints. So, restraints అనేవి మన యాక్టివిటీని చాలా తగ్గిస్తుంది అనమాట, ఎస్పెషల్లీ పోస్ట్ ఆపరేటివ్ కేసెస్లో అగ్రెసివ్ పేషెంట్స్లో మనం ఇది వాడతాం. ఎవ్రీ 24 hours you must, after 24 hours you should take consent from their guardian or parents or family members who is in charge of that patient. Okay, in a patient who is stabilized on lithium therapy, the lithium level should be checked 8 to 12 hours after the first dose, then 2 or 3 times weekly during the first month, and the level should be checked weekly to monthly during the maintenance therapy. So, after the first dose we have to check the lithium, and then 2 or 3 times during the first month, and whether monthly or weekly basis after the maintenance therapy. The primary purpose of psychotropic drug is to decrease the patient's symptoms and to which improves the patient function and increases compliance of the therapy. So, any kind of drug when we are using in the psychiatry treatment, it should be useful for the patient and the patient should follow certain guidelines when using those kind of medication. Manipulation is a maladaptive method of meeting one's needs because it disregards the needs and feelings of others. Manipulative method, manipulation అంటే వాళ్ళు కావాల్సింది వాళ్ళు దక్కించుకోవడానికి they use this kind of method, meeting one's needs, whatever the way they want to win that particular, for example, recently this NEET exam what was conducted. So, few people have manipulated and they were responsible for this manipulating the answer sheet, and one day before itself they came to know. So, this is one kind of manipulative method. While aa pani jaragalante jarigi teeralani they will manipulate. And this is the 96th slide. This is the last slide. Dash is the use of imaginary experiences or made up information to fill missing gaps of memory. You might have seen this Telugu movie, Manmadudu movie lo, the Nagarjuna's mother will, hero Nagarjuna garu mother will tell that అమ్మాయి పెళ్లి చేసుకొని వెళ్ళిపోయింది and she is no పెళ్లి చేసుకొని వెళ్ళిపోయింది, so you should move on in his life అని చెప్తుంది అనమాట. So this is one kind of diagnosis. Yes, Monica and Purnima, you are told correctly. So that is called as imaginary way of filling up the gaps in your brain. confabulation, and they will be unaware of the truth and they will be living with that the same thought. So that's all for today, folks. So around 1.5 hour class we today got over, and we will get ready with the next session. Okay, anything else? Thanks for the class. Okay, Monica, Tamil Selvi, Supreme Status. Thank you for the class, ma'am. Okay, thank you for you. Thank you, ma'am. Great revision. Thank you, Purnima. Pasha 007. Thank you. Thank you. Thank you. Thank you. Thank you, City. Bye bye. Take care. Write your exams well. Thank you, Kalyani. Thank you. Thank you. Thank you. Bye bye bye. Bye, City. When will be the next class? My dear, I am taking paid classes for students. If you want to join my paid classes, there is a link in the WhatsApp. But in 3 days, I am not going to take any money. Okay. So next class will be paid. Will be there only for the paid members, not for others. Okay.